Hello. Prescribing Safety Exam, or better known as the PSA, is an exam sat by med students in the UK in their final year of medical school. And I thought it would be a good idea to impart some tips and advice that I feel was very useful for me when I sat the exam in May 2020. I should state that the advice and the tips that I am imparting are of my opinion and are based on my experience of revising and sitting for the PSA. Just a quick overview of the PSA exam. It's a 60-question exam that carries 200 marks, done over 2 hours. It's done over multiple settings in a year. And it usually carries about 60 to 67% pass mark, and there's no particular syllabus for this exam, but it's essentially an accumulation of all your prescribing knowledge over the 3 clinical years. In the traditional medical school way, I've decided to organise my tips and advice as pre-PSA, i.e. your revision period, during your PSA exam, and post-PSA tips. One of the key pieces of advice that I would impart in preparing for your PSA is to practice. There are several resources available, including questions on past medicine, past the PSA book. There is an online tutorial called Prepare for the PSA, which is essentially a practice exam that's very useful to do, and I found that very helpful. I'll drop the link below. There are other resources such as Essential Practical Prescribing book, and the Unofficial Guide to Prescribing. I'll drop those links below too. In addition to that, there are 4 official past papers that consist of 30 questions each on the PSA website. These are varied from their difficulty, so they are a must to do. I'd say start with one of them during your start of your revision period, so it gives you a sense on how to guide your revision, essentially. Another tip that I have is to read the PSA blueprint. It's on their website and it helps to identify your areas of weaknesses, and it helps you brush up on these before the exam. Another advice that I would give is to know your common monitoring drugs, things like methotrexate, lithium, warfarin, theophylline, gentamicin or vancomycin. These are quite important, and although you have the resources available by Medicines Complete and BNF, it's quite good to have this in the back of your mind, so when you have a multiple answer questions, it's easy to pick out the correct answer quickly. Another advice that I would give is to practice drug calculations. These questions are worth 16 marks in the paper. They're the easiest marks to get, so do practice them. You can do I think there is a dedicated chapter in the past the PSA book, as well as on questions on past medicine, so do give them a shot. They're easy marks. And for my final pre-PSA tip is to familiarise yourself with Medicines Complete BNF and Nice BNF. These are 2 resources that will be given to you by the PSA exam. You can use either one of them or both of them, it's up to you, but I'd suggest get used to each of them during the revision period so you know which one you feel comfortable using. Those 2 resources are pretty much the same, except for that the Medicines Complete BNF has a larger search option. My first during PSA exam tip is to use Control F. It will be your best friend. It will help you look up information very quickly and help you save time during the exam. The second piece of advice is to use the BNF treatment summaries. These are both available in both Medicines Complete and Nice BNFs. And if there is a prescribing question that you're not unsure of, you can use the treatment summary to find the drug that you need to prescribe. Also on the Medicines Complete BNF, there's a handy trick to looking up interactions between drugs. So essentially on the search bar, if you type in all of the drugs that you need to look at whether if they're interacting and separate them with a comma and click enter, it will give you a tally of which drugs interact with which ones and what the severity levels are. Another tip that I will give is to always double check the dosage you need to give for the patient and the drug preparation under the medicinal forms in the BNF. Also, always check for contraindications, interactions with any current medications the patient's on, and whether if they had any allergies as well. Another tip is that the exam is very time pressured, so do all the official past papers and other past questions to get used to the time limit. And I'd suggest spend a little more time on the prescribing and prescription review questions on the exam, as they carry more marks. And finally, if you're having technical problems during the exam, call your invigilator over, and you may be given extra time if the problem has caused you significant delay, but this is under the discretion of the invigilator. So do have that in the back of your mind. Ask your medical school on how this works. Post-PSA, results will come out 2 to 3 weeks after the exam and will be published on the PSA website under the assessment feedback section. The results will be divided according to the different sections of the paper, which gives you a handy tip on where you could in the future improve. You will also be given a certificate that you need to download and present to your foundation school. After the PSA exam, forget about everything. That exam is very time pressured, and when you finish the exam, you will feel unsure about how it went. So don't overthink it, and just know that it will be okay. That's pretty much all from me. Good luck for your exam. If there are any questions, just drop them on the comments below, and I will try and answer them as soon as possible.